Hi, I'm Shiv Gaglani, and today on Raise the Line, I'm happy to be joined by Dhiren Patel, who's a doctor of pharmacy and vice president of medical affairs at Pack Health. Pack Health is a leading digital health coaching company that helps people with chronic conditions develop self-management skills to improve their health. And it also happens to be a sister company where we share advisors and investors in Coveris. We're part of the same strategic health alliance through Coveris. So Dhiren is a faculty member at the Alpert Medical School of Brown University, as well as at the Massachusetts College of Pharmacy in Boston, and he sees patients at the Boston VA. So I don't know how you do it all, Dhiren. So Pack Health's experienced a large spike in demand for its services due to COVID-19, and we're looking forward to learning more about you, the company, and the journey you've been on with your teammates. So thanks for joining us, Dhiren.
Thank you for having me.
Even though I gave you this long intro, I was curious if you could start by telling us a bit more about your background and how you ended up focusing in on chronic disease management.
Sure. So I'm a clinical pharmacist by background. I trained locally in Boston, and one of the areas that I went into was chronic disease and specifically diabetes and endocrine. Have a very strong family history of diabetes, and one of the reasons my father has it, grandmother, grandfather, and so something that I was interested in. Been seeing patients for 12 years in a diabetes clinic, and one thing that was very evident to me is like I was making impact on my panel, my census of patients, but you know kept repeatedly seeing the same issues surface. And I'm like, there's got to be a better way to be able to deliver this. And back in 2013, 2014, I actually met our CEO, Mazi, at a bar in Boston. This is actually how it all got started, through a friend of mine. And at this point, he had this idea, uh, sketched out on a napkin, and is thinking of doing this. And I'm like, this makes a total sense. I got the pain point because it's something that I was living with every day. Can only see 10, 12 patients, and then they're gone for another 3 months, and I couldn't really do much to help them in between their visits. And so I asked him, I was like, there's a lot of chronic conditions. Which condition are you going to be, focusing on or starting with? And he said diabetes. And I said, why? And he's like, I did a Google search and I went on CDC, and there's a lot of people that have diabetes. I was like, okay. And I was like, well, here's how I can help you, and why. And didn't think anything would come out of that interaction. We have, a lot of those type of interactions. And then 2 weeks later, him and his co-founder, who are not clinicians, called and said, all right, we want to get started. What do we do? What do we tell these patients? And so that's kind of how it all started. And I saw the opportunity to kind of do what I was doing in clinic, have a complementary service to help these, patients extend their care beyond the four walls of my clinic. And that's kind of how it all got started.
That's awesome. I actually didn't know that backstory. Even though I've met you and Mazi multiple times, so that's really great to hear.
Yeah.
Um, and so, Pack Health, obviously, you got your start with diabetes, but I know you've expanded quite a bit, and including multiple sclerosis and several other things. Could you tell us more about Pack Health, what you all actually offer, and how you see it fitting into the larger healthcare landscape?
Yeah, that's a really good question, and I think that's one of the things that it kind of set us apart from the beginning. We started it in one condition, and we say that, but one of my biggest feedbacks to Mazi is like, listen, I see patients in a diabetes clinic, but they have diabetes, but they also have COPD and heart failure, and no one just has one condition. And so at that point, they had done a market assessment. There were a lot of other bigger, well-known companies that now we call them point solutions, right? Because they only deal with one condition, and that's the early insight. And we actually got a lot of advice along the way to not do that. Everyone thought we weren't focused, and we were all over the place because we were focusing on multiple conditions. And one thing I told him is that I can tell you that none of my patients have diabetes, and I'm telling you, if you move away from that model, the adoption by providers like myself, the health systems, the payers, it's not just going to work. We provide digital health coaching and remote patient monitoring for over 25 plus chronic conditions. And if you think about it, if you just offered one, how is you or as a patient going to be able to have a coach for your heart failure, your COPD, for your diabetes? Or how could you expect a payer or a health system to, then you can imagine that patient member experience just doesn't work, right? And you need to holistically take care of that patient. And I think that's what we've stayed true to. And over the years, that's kind of, we've been hyper focused on the member. I go back and forth between patient and member, but we call them members. um, and addressing some of these social determinants of health, because we know that it's not just take your insulin or take your medications. There's so many other factors that go into maybe why a patient misses their insulin. Is it cost, food insecurity? There's so many things. And so our kind of motto is let's be the quarterback for that patient, take care of all of their needs for their chronic conditions. And as many of the barriers that we can take down is going to help us move us that patient so much closer to getting to their, clinical outcomes, clinical goals that they have.
That's a great insight. I know oftentimes we hear that we have to stay focused. If you have more than three priorities, you have no priorities, as Jim Collins says. But
Yeah.
the fact is, a lot of these patients and members that you're all treating do have multiple comorbidities, and that's part of why they need that quarterback, as you're saying. So, what kind of results do you see, or have you seen with the members to date?
Yeah, so across all of our conditions, we have a very academic and research gene and all of the folks in our company. So we publish at all of the major meetings, the American Diabetes Association meeting. We have an oncology meeting coming up here in a few weeks. Consistently, and I'll take diabetes as an example since we've been talking about that, we see a decrease in hemoglobin A1C of 1% in 12 weeks. We've actually done longitudinal studies because early on they're like, "This is great. You were able to show this impact in 12 weeks. Um, what's the assurance that this is going to, last?" And that's, where I always go back and say, we want to teach these patients how to fish so that they can fish on their own. And we showed maintenance in that decrease in A1C up to a year, where it comes up a little, but we're still, sitting around 0.9%. From an initial decrease of 1%, and we're starting off at a baseline of around 8.5% on a patient's A1C.
Wow, that's awesome. So that's diabetes is one example. And have you done some research yet in some of the other programs that you all offer together?
Yeah. So our other big buckets, so cardiometabolic, I shared that example of diabetes is one. Our oncology is a pretty big offering, and then our autoimmune is another big one. Across the board, I'll share some cross-cutting measures. We use validated, what we call PRO or patient-reported outcomes tools to measure this, and so ones that you're probably familiar with, like PHQ-4, PHQ-9, and we measure these across all of our conditions. And so that's what we call our cross-cutting measures. So we consistently see improvements in stress, anxiety, depression. And these are all things, when you think about chronic conditions, that are big contributors to non-adherence. And so when we see improvements in non-adherence, variety of clients say, how is it that you're able to improve medication adherence? Well, if you help figure out the underlying issues as to why that patient wasn't taking that medication, it could be that they were depressed. Maybe they didn't have access to transportation. Whatever that is, will help with these, but consistently across the board, in just a behavioral health, mental health standpoint, we're seeing decreases on the validated scales up to 30%, reduction in flares for RA, 50% decrease in flares. And as you know, and you guys do a lot of great content videos around this for chronic conditions, 80% of the things are the same, right? There's a huge influence of physical activity, of what your diet, social factors such as alcohol, smoking, and there's obviously then condition specific things, but there's a lot of these things for just general health maintenance from a chronic condition standpoint that we should all be doing. And so we try to focus on those and then just get really good at, what that 20% that's different for each condition, that, we need to customize, create content around, and making sure that our coaches are advising around.
Yeah, no, totally. I 100% get that. And so, a lot of what you focus on is changing member behavior, patient
Mhm.
behavior, and that's one of the hardest things to do. So I'm curious, like, what insights have you all developed that have made you effective at seeing those results?
Yeah, so for us, we're grounded in that behavior change science, and it's a bunch of them that we use. More common ones and popular ones that folks are probably aware of is the BJ Fogg model, you know, um, the trans-theoretical model. We use like reflective listening, motivational interviewing, and we try to deliver what we call digital empathy. That's kind of our goal, and so we have all of the stages of behavior change, and we try to factor in all of that. But the big thing is you got to meet the patients where they're at, and the high touch. model that we have is we're engaging with the patient 5 times in a given week. So it's 3 text messages, 1 email, and 1 phone call. So if you think about it, we're in that patient's pocket, and you don't require an app or a portal or a login. If you think about how we engage with our friends and family, you take out your phone, you send an email, you send a text message and a phone call. That is literally how you engage with us. There is no username. It's the same phone number, and that patient can talk to their health advisor as many times as they want. It's not like I'll schedule it. Like, we don't schedule, meetings with our friends. We text them when we need to, and it should be no difference accessing, coaching. And so we've made it that simple. Everything on our back end is collected and tracked, and we have the ability to look at it. But we wanted to put all of the technology on our side and not complicate it for the patients. Because if it was going to be another app that was on the 6th page of their phone, it wasn't going to get utilized, right? And so we made that engagement frictionless for them.
Yeah, that's fantastic. I mean, we when we were starting Osmosis, leveraged the BJ Fogg B equals MAT to try making things more frictionless. And so even though we do have an app, people can then access videos and get push notifications of questions. The original was we would actually just send text messages to our friends and family, or friends and other medical students with questions to get them learning and reviewing. So that's a super smart insight.
And I'll add to that. I mean, in your case, the app makes total sense and is very necessary, and we have one, right? But we don't require it for engagement like you do, right? Where some companies are built solely on that. Where this is a tool, if you want to use it, we certainly have the option. But if you don't have a smartphone, life will still continue, and it's not going to be like, well, we can't do anything with you.
Got it. Makes sense. Yeah. So you had mentioned earlier about improvements in reducing patients' stress, anxiety, and depression. The last few weeks have probably led to a lot more stress, anxiety, and depression than we've seen in a while because of COVID-19. Yeah. Can you talk to us a bit more about what you and Pack Health are doing and how COVID-19 has affected the business?
Yeah. So we kind of went through like 3 phases there. The first is kind of what I'm calling like the stabilization phase, because when no one really knew what to do, we made sure that our frontline, and those are our health advisors, like they were safe. They had all the tools that they needed, because we knew that in every article that you and I have read, and you guys have done some other amazing, podcasts, is like everything that you heard was like folks with underlying conditions. That was all of our patients, right? So we needed to make sure that our frontline folks, which are our health advisors, were protected. They were able to work from home and continue to engage these patients that were at the highest risk. And so we did that pretty quickly. And we've been remote since then. The second was the surge in healthcare utilization, or the capacity that needed to be created. So what started happening with clients of ours is patients that had COPD or heart failure that were in the hospitals were being discharged early to create capacity for the COVID patients that were going to be coming in, or they wanted to make sure that the patient that wasn't infected was safe because they were at high risk. And so either way, they needed to get them out of the hospital. But at the same token, their COPD or their heart failure exacerbation didn't go away. So we were helping to remotely monitor these patients, and so that if something were to happen, we can care coordinate and care escalate back to that system. The other, and a smaller cohort of it, were those patients that did have COVID that just needed to be remotely monitored. And so we picked up those patients that could care for themselves and recover at home, but someone wanted to make sure that they were keeping a close eye on them in case things did go south. And so, we served a role there. And now I think the bigger, when I'm thinking about the next phase of it is, as we come out of this, even though we're not really out of it, America, and we've all now kind of decided that we've kind of had enough of this quarantine, and things are starting to pick back up here. So, what does that new normal look like? And I think, your model, our model, I think some of these things are here to stay. And now you talk to patients and they don't necessarily want to come in for every visit because they just got a taste of tele whatever, right? And every system did, every provider, every patient, all of a sudden in the last 2 months has now completely understood what telemedicine, telecoaching, digital health coaching is. And I think there'll be some regression to the mean. I think some folks, it'll go back, but a lot of patients are like, this is what's better for me. I don't want to drive an hour to come, share my blood sugar readings with you when I can do that remotely. And then let's get on the phone and kind of talk about that. So I think those are kind of the three phases that we had and kind of how we dealt with them.
Yeah, no, that's super, super exciting. And I agree. Like there's a quote I've shared pretty often with the team about how it was actually Lennon who said it. He said, there are decades where nothing happens and there are weeks where decades happen. And so some of the
Totally.
things we were looking at from a telehealth perspective, a work from home perspective, online learning, which is our space, things that we were thinking would take till 2023, 2025 to come to fruition,
Yeah.
are coming to fruition now in the matter of weeks or months.
Yeah, absolutely. And even still teaching. So I teach in our digital health elective at the Mass College of Pharmacy and others. And I think the learning piece is one of those that now everyone, that whole model has been just wrecked, right? And so I think what you guys were doing early on, now it's totally been cemented. And, it's unfortunate that it took a pandemic to, prove some of our models, including yours. But there's never been a better time now, for our companies to be moving forward and, delivering care and learning in digital virtual models.
100%. Yeah, it's kind of exciting times that we're able to actually do things that'll make a difference. And as we say, raise the line. So speaking of your other hat as a pharmacist by training, I'm curious, how is COVID-19 affecting pharmacists specifically in that industry, the whole overall pharmacy industry?
Yeah, I'm actually very proud of our profession and kind of what's happened here. I mean, early on, I think they weren't in that front line, you know, characterization, but I think slowly, that has happened, and you've seen, the pharmacies are still open. They're still dispensing drug, and you even saw that in some of the legislation, like in the HEROES Act. Initially, pharmacists weren't going to be a part of that, and then they made that change. Just recently in California, you saw they're now part of the folks that can administer the COVID tests. And HHS just came yesterday and kind of clarified that, saying that our ruling is going to trump any state requirements that would prohibit me from ordering a COVID test. So I'm really proud of kind of, what the profession has stepped up and done here, because, we're very accessible. One of the most trusted professions year after year. Pharmacists are on top of that, top of that list. And then the big one is the fact that we were testing all of these drugs that were off label, right? And so every drug that was being administered, whether early on it was hydroxychloroquine or remdesivir, these were all what we call off label investigational drugs. And so it required a massive response on the folks in each of these institutions to put together these protocols, because they were all being administered under a protocol or emergency use case. And so, the banding of that community to kind of share best practices and saying, we've tried this didn't work, or this worked, here's what made it better. I think that sometimes doesn't deserve, it doesn't get into, the mainstream media, but I think the pharmacists have done a phenomenal job there.
Yeah, I mean, makes sense now that I think about it, but that's fascinating. So, to actually develop and enforce the protocols that required clinical pharmacologists and pharmacists on staff, right?
Yeah, absolutely.
Wonderful. So speaking of kind of professions in healthcare, I know Pack Health's also created a health coaching institute, and we've had the pleasure of talking to Mazi and Mikhail on your team about that. Can you talk more about the health coaching as a profession? Because correct me if I'm wrong, you've hired like more of your clinical staff are health coaches than any other kind of clinical staff on board at Pack, right?
Yeah, absolutely. And we think that industry is going to continue to grow. And if you kind of think about where we've thought medicine is going, we had specialists, and then we had primary care doctors, and then we're like, great, we have NPs and PAs. They're going to help with that. And now the NPs and PAs also want to specialize. And, it's just, you have pharmacists helping. There's just so many chronic conditions. And I always say it takes a village to take care of patients with chronic conditions, where we need everyone on the team. And, I think coaches or health coaches and health advisors are going to be a part of that team, to the point where now they've designated a CPT category 3 for health coaches. And so CPT category 3 doesn't allow you to bill, but they're using that for monitoring so that when you do get elevated to the actual CPT codes that physicians, clinicians use, and you can get reimbursed for your services. So that's a pretty big step that you can see is headed in the right direction, to the point where there's going to be reimbursement tied for the services rendered.
That's fascinating. So yeah, I think it's really an interesting space to watch. And again, telehealth, I mean, all of this stuff with the CARES Act has catalyzed telehealth. So hopefully health coaching will be part of that too. I know we're coming up on time. So just two more quick questions. One is, as a health professional yourself, do you have any advice to early stage health professionals or even students who are members of our audience about challenges of the COVID moment and how they should approach the next few years in healthcare?
Yeah, and this is something I've even told, our cohorts. So we're a teaching our institution even at Pac Health. So I have students rotating with me. I have 4 pharmacy students that rotate every 6 weeks, and other groups take dietetic interns and behavioral psychology interns. And I know a lot of people's, graduation plans and things kind of got uprooted. And, it's kind of to that message the point that you made earlier. It's okay. You've been learning for 4 or 5 years and been paying to learn. Now it's your time to go find a job, and that will allow you to continue to learn. And I know there's a lot of hesitation with, some things. Classes went online quickly and it wasn't the same experience or the college experience. And I say it's okay, right? You missed a half a semester of something, but your learning is just now starting. So don't worry about it, right? Follow your passion, follow your dream. Now just find a job that allow you to learn for another 4 or 5 years. And your learning is just now starting. You're getting into that, experiential phase of your life where you're, starting to now apply things. I'd say also keep an open mind. Medication or medicine is going to be, delivered very differently. Learning is going to be very different. And so embrace some of the new modalities that are now here to stay, such as distance learning, virtual learning, flipped classrooms. These are different things that historically people have been used to just that lecture approach. And I think the skill set that's needed is very different. And I think some of the things that you guys are doing and how education is being delivered, I think is the next kind of wave. And my message is embrace that wave. You can be a part of that change. And I always tell my students, do you want to be the taxi driver or do you want to be the Uber, right? And you can sit there and just, resist and see what happened, to that industry. And so my message is, try to be on the disruptive side of any change if you can.
That's a great message. Thanks for sharing that. So one final question. Are there any other comments or thoughts you'd like to share before we wrap up?
Yeah, I would, and in terms of just final thoughts, I don't think we're out of this pandemic. If there's anything that we realize, there's a lot of things that we're going to have to think through differently. Some of the same points that we just discussed earlier, medicine, learning, travel. I mean, my message there is, we still need to be hyper vigilant of what we're doing. We're not in the clear. We're going to learn a lot. We're going to make a lot of mistakes. But it's, how quickly we learn from those mistakes, how quickly we can share data with each other. You have big companies that normally wouldn't work together that are working together, sharing data. Hospitals are sharing and bartering supplies because someone has extra ventilators and doesn't have PPEs. And so, again, that message there is just be prepared to live in this new norm, whether it's working from home, learning, how medicine is going to be delivered, practiced. I think change will be the new constant.
Great parting words of wisdom. So thanks so much for taking the time to be with us today, Dhiren.
Thank you guys for the opportunity, and kudos again on the great work that you are doing to keep all the higher institutions and academic institutions still going.
Thanks so much. So with that, I'm Shiv. Thanks to our audience for checking out today's show. And remember to do your part to flatten the curve and raise the line. We're all in this together. Take care.
Thank you.